All right, I'm going to demonstrate how to establish vascular access in the external jugular. So first of all, we have our BSI, we have our gloves and goggles, and our scene is safe. We're going to explain the procedure to the patient if they're awake. And we have our normal saline bag here that is already stripped out and diced. And the rest of our equipment, we have an 18 gauge IV catheter. You want at least an 18 or bigger if possible. We don't need our constricting band, so I'll set that aside. We have an alcohol prep pad, some gauze, some tape, which I have a few pieces already. Set up the rest of our equipment here. So open up your IV catheter and open up your Venous guard. All right, so we're gonna take off the cap and make sure that you twist the catheter here to loosen it up and maintain control of that catheter so it doesn't move. I'm gonna put my thumb back at the base of the clavicle here, and that serves two purposes. It's going to stabilize the vein, and it's also helping to bring the vein up. So one other consideration you might wanna do is you might wanna put your forearm on the patient's jaw just to hold their head over to the side. You always want to have their head turned toward the opposite side that you're poking, and putting your arm there keeps them from flinching and turning their head back the other direction. So I'm bracing on the clavicle and on my forearm here, and I see my vein. I'm going to go in a shallow angle and insert, feeling for a pop, and also looking at my flash chamber to see if there's a flash. You're not always going to get a flash with EJs. If you don't, just go ahead and insert your catheter, and it should feel pretty smooth going in. If you meet resistance, it's likely not in the right place. We're going to lock this back in place, and we're going to tamponade. So make sure that you're tamponading really well, because there is a risk of air embolus if you let go. I'm going to take that off and put that directly into the sharps. Now we'll attach our IV tubing here. Secure it down and open it up. And we're going to check to make sure that we have good flow, and we do. I'll put that down to TKO, and we'll secure this down with the Venous guard. Now when you're securing this, you want to wrap this part around the patient's ear. That way you secured it, and you also have access to this port if necessary. So that'll go around the ear, and then we will tape it again back here at the base of the neck. Now reassess the patient, and you're all set. So this is a different kind of IV catheter. It's still an 18 gauge, but it's a little bit different. This one has a button that we're going to click to retract the needle, and you use it a little bit differently than the one that you retracted earlier. So our patient is the same, and we've already gone through everything else. This site has already been cleansed, so I'm going to open it up. And on this one, we're not actually going to spin the catheter. It's actually locked in place. And on this one, the flash, you'll actually see it come up the needle and also in the flash chamber. So just like before, we're going to brace our forearm on the jaw and also our thumb down on the clavicle to raise up that vein. And we're going to go into that external jugular at a shallow angle, feeling for a pop, looking for the flash. Okay, and we're going to just push forward on the catheter. And now at this point, you need to move your hand so that you're tamponading before you hit that button. If I hit the button right now, it's going to start bleeding, and you might also get the air embolus. So I'm going to shift my hands, tamponading and stabilizing, and now I'm just going to simply push the button. It retracts the needle, and we'll put that in the sharps. Now we'll attach our IV tubing here. Secure it down and open it up. And we're going to check to make sure that we have good flow, and we do. I'll put that down to TKO, and we'll secure this down with the Venous guard. Now when you're securing this, you want to wrap this part around the patient's ear. That way you secured it, and you also have access to this port if necessary. So that'll go around the ear, and then we will tape it again back here at the base of the neck. Now reassess the patient and you're all set.